It's estimated that diabetes affects over 250 million people worldwide. In the United States alone, diabetes affects over 20 million people and costs taxpayers an estimated $250 billion annually and $25 billion annually in the state of California alone, and the cost is rising. In pre-diabetes, blood glucose levels are higher than normal, but are not high enough for a diagnosis of diabetes. The onset of diabetes shows symptoms as early as 10 years before an actual diabetes diagnosis can be achieved. Dr. Ricky Hunt and Biomagnetic Systems have created a system that can identify early candidates for diabetes long before the effects and consequences of diabetes are felt.
We've identified the actual cause of diabetes, and we know how it grows and builds in the body. And 97% of all diabetics are type 2s. So that's what we're going to concern ourselves with, is the type 2 diabetics. So in our program, what we've done, we've identified that diabetes begins with a low-grade viral infection in the bone marrow. Now, this may be new to you, but this is where all this comes from. So that's where the virus begins, and what it does, it causes a blood coagulation disorder, and it causes this thick, viscous blood to start collecting and coating the inside of your central organs. So this process takes 10 to 20 years, and we can identify a diabetic 10 years before they have their onset, and we can erase all of the components that create the disease. So our situation is that we have a test, and the test has a very low fee, and the test will tell you exactly who's going to be a diabetic in your family and who isn't. And we'll be able to tell you exactly what that is, and we can measure the viral entities that are involved in diabetes, and we can identify the blood coagulation problem that coats the organs, and tell you how much you have there and when it will cause a diabetic onset. So we're going to start out our program. This is a pre-diabetes program, and we'll be able to identify exactly which members of your family are going to be potential diabetics and which aren't. And the ones that aren't will never be. So it's an interesting situation, but we will soon be able to do that for you. We'll be able to test the patient, tell you exactly where they stand as far as diabetes, and then tell them not to worry about diabetes, that they're never going to develop the disease, or if their brother or sister is going to develop the disease, and how to turn it around. So we want to really push this new program because it could affect so many people. The last I was reading in LA, up to 50% of the Hispanic population in LA are now pre-diabetics. So, you know, it's a situation where we can turn that around. We can completely erase those symptoms, eliminate those infections, and completely reverse the whole process of diabetes. So this is what our goal is, and this is what we hope to really be doing a lot of very soon.
The CDC's Department of Parasitic Diseases has determined that there are 6 basic forms of parasites, some of which cause birth defects, sickness, and in some cases, even death.
You know, parasites are such an incredible problem these days. We're getting amoebas from different types of food, and you know, right now, I go out and purchase groceries, and when I come back home, I test them before we put them in the refrigerator. And when I test those fruits and vegetables, we find about 25% of the fruits and vegetables have flesh-eating bacteria. They have worms, worm eggs. They have different types of bacteria, and it's just terrible. I mean, we are shipping into this country from all over the world all types of not only pesticides and things, actual parasites and eggs of parasites in almost all of our fruits and vegetables. So it's become a real problem. And the problem now, because our immune systems are so depleted, that these things get in our bodies, and that people don't even know that they're harvesting large crops of worms and things in their gut, and it's just all of this amounts up to huge health criteria, health potential that's going to be lost.
Recent advances in stem cell research have yielded some groundbreaking and innovative notions of how the body can use its own properties to heal itself. Dr. Ricky Hunt has developed a totally new line of aura patches that incorporate this line of theory.
About 2 years ago, we identified the master stem cell frequencies. And then from that, we broke that down into 13 sub-informational platforms. Those 13 platforms create our 13 different therapies. And it's all of the stem cell information that goes to the heart, all the stem cell information that goes to the colon, all the stem cell therapy that goes to the thyroid. So we've developed these therapies, and we've been able to compartmentalize them into certain sections of the body, but it contains all of the stem cell therapy. So it's been working well. We have a spinal cord stem cell, and we're getting. I think a doctor called me the other day, and he said that one of his patients that was on our stem cell therapy for spinal cord started using his hand again, started regaining use of his hand. We have a huge number of autism patients that are using our new brainstem. And we're getting very positive reports back from all the facilities that are using the brainstem with these students, and are doing really well. They've been on our typical autism program and have eliminated the infections and the things that are associated with the stem cells, or with the associated with the autism program. But now our situation is that we're doing these secondary students are using the stem cell, and now we're getting very positive results back on that.
The Aura Patch system is not an over-the-counter remedy. It can only be prescribed by a doctor, practitioner, or healthcare professional. For more information, please log on to www.aurapatches.com.